Hello, this video is on Jardiance. So what is Jardiance used for? It's used for type 2 diabetes or non-insulin dependent diabetes in adults aged 18 years and over. Jardiance tablets can be used on their own to improve blood sugar control in people whose blood sugar is not controlled by changes to their diet and exercise alone, and who can't take an anti-diabetic medicine called metformin. So Jardiance tablets can also be used for people with type 2 diabetes whose blood sugar is not sufficiently controlled by other anti-diabetic medicines. It can be added to treatment with medicines such as metformin, a sulfonylurea such as gliclazide or glibenclamide, or treatment with insulin. So how does Jardiance work? Jardiance tablets contain the active ingredient empagliflozin, which is a type of medicine called an SGLT2 inhibitor. In type 2 diabetes, the cells in the body become resistant to the action of insulin. Insulin is the main hormone responsible for controlling the level of sugar or glucose in the blood. It makes cells in the body remove sugar from the blood. When the cells are resistant to insulin, this makes blood sugar levels rise too high. Jardiance works in the kidneys, where it allows the body to excrete excess glucose from the blood into the urine. Normally, when the kidneys filter and clean the blood, glucose is filtered out of the blood at the same time. The glucose is then reabsorbed back into the blood by a mechanism called the sodium glucose transporter 2. The kidneys normally reabsorb glucose back into the blood, even when the levels of glucose in the blood are too high, as in diabetes. So Jardiance works by inhibiting the SGL2 transporter. This allows excess glucose to be filtered out of the blood and excreted in the urine. This will reduce blood sugar levels. So Jardiance has two other main effects that may be of benefit for people with diabetes. Firstly, it may cause weight loss due to the loss of sugar from the body. And secondly, it causes a small increase in the amount of water being filtered out of the body into the urine, or diuresis. This may help to reduce blood pressure. So how do I take Jardiance? Jardiance should be taken once a day. The usual dose is 10 mg once daily. Your doctor may decide to increase your dose to 25 mg once daily if your blood sugar is not controlled well enough. The tablets should be swallowed whole with a drink of water. They can be taken either with or without food. You can take the tablet at any time during the day, but try to take it at the same time each day. This will help you remember to take it. If you forget to take a tablet and it's more than 12 hours until your next dose, take the missed dose. Then take your next one at the usual time. If it is less than 12 hours until your next dose is due, then do not take the missed dose. Just take your next tablet at your usual time. Do not take a double dose to make up for an earlier missed dose. So what should I know before taking Jardiance? It is important that you continue to follow the diet and exercise advice given to you by your doctor or nurse while you are taking Jardiance. Jardiance only helps to control your blood sugar levels and should not be used as a substitute for eating unhealthily and taking regular exercise. Jardiance should be used with caution by elderly people. This medicine is not recommended for people over 85 years of age, people with kidney problems, people taking medicines for high blood pressure who have a history of low blood pressure or feeling dizzy, people with heart disease or heart failure, people with a high percentage of red blood cells in the blood, people with a history of frequent urinary tract infections, people with a history of frequent genital infections such as thrush, who should not take Jardiance. So those who should not take Jardiance are people with type 1 diabetes, people with diabetic ketoacidosis, people with moderate to severely decreased kidney function, people with severely decreased liver function, and women who are pregnant or breastfeeding. People who are allergic to any ingredient of the medicine, for example, people with rare hereditary problems of galactose intolerance, the lactose deficiency or glucose galactose malabsorption. So the Jardiance tablets contain lactose. So Jardiance is not recommended for people taking loop diuretics such as furosemide. And Jardiance is not recommended for people with low fluid volume or salt levels in the body, e.g. due to diuretic therapy or diarrhea or vomiting. Jardiance is not recommended for children and adolescents under 18 years of age because its safety and effectiveness have not been studied in this age group. So can I take Jardiance while pregnant or breastfeeding? The safety of Jardiance for use during pregnancy has not been established, and Jardiance should not be used during pregnancy. Diabetes mellitus is usually controlled using insulin during pregnancy because this provides a more stable control of blood sugar. If you get pregnant while taking Jardiance or are planning a pregnancy, you should seek medical advice from your doctor. It is not known if Jardiance passes into breast milk. The manufacturer states that Jardiance should not be used by breastfeeding mothers. So what are the possible side effects of Jardiance? So a very common one would be low blood sugar levels when used with a sulfonylurea such as glibenclamide or with insulin. A common side effect, vaginal thrush, inflammation of the penis or the foreskin due to a thrush infection, increased production of urine, which is polyuria, and urinary tract infections, itchy skin, and difficulty or pain passing urine, dehydration. So consult a doctor straight away if you've experienced symptoms of these, such as excessive thirst, a very dry or sticky mouth, dizziness, sleepiness, a fast heartbeat, or passing little or no urine. So if you want any more information about the possible side effects of Jardiance, you should talk to your doctor or pharmacist, or read the leaflet that comes with your medicine. So can I take other medicines with Jardiance? It is important to tell your doctor or pharmacist what medicines you're already taking, including those bought without a prescription and herbal medicines, before you start taking treatment with Jardiance. Similarly, check with your doctor or pharmacist before taking any new medicines while taking this one, to make sure that the combination is safe. Jardiance may enhance the effect of diuretic medicines such as furosemide or bendrofluozide, which help to remove water from your body. Your doctor may change your dose of Jardiance or the diuretic medicine to make sure that you do not lose too much fluid. Jardiance is not recommended for people who are taking loop diuretics such as furosemide or bumetanide. Medicines that increase blood sugar levels as a side effect may make Jardiance less effective at controlling blood sugar. Medicines that can increase blood sugar levels include the following ones. So antipsychotic medicines such as chlorpromazine, olanzapine and risperidone. Beta-2 agonists such as salbutamol, which is a Ventolin. Corticosteroids such as prednisolone, glucosamine, estrogens and progestrogens such as those found in the oral contraceptives and HRT, thiazide diuretics such as bendrofluozide. So if you have any further questions on this, you can contact me through the live pharmacist on the website. You can email me or call into the pharmacy here in Broaddale and Douglas, up Maryborough Hill. Thank you for watching.